Knowing which chromosomes have mutations that can cause certain genetic diseases can be pretty helpful for the step 1. They'll often describe a patient and then say that there is a mutation on a particular chromosome, and usually you'll have a pretty good sense of what the disease is from the description, but if you know the chromosome also, then the question can change from a hard one to an easy one. Sometimes they'll also describe a disease and then ask you what chromosome the mutation is on, so it's important to know these. You should take the time to sit down and quiz yourself on this a few times before now in the exam to make sure you know them, but I'll give you some tips. Hopefully these chromosomes are still in your short-term memory, but what makes them special? Trisomies. Trisomies in these chromosomes cause which diseases? That would be Down for 21, Edward for 18, and 13 is Patau. We talked about chromosome 3 in the autosomal dominant diseases. Remember what disease this one is? That's VHL, or von Hippel-Lindau, because remember, the name has 3 letters in it. What's the high-yield disease for chromosome 4? Think of our mnemonic, hunting for food, is Huntington's disease. I'll just do a couple more. What about chromosome 7? I like to think of the 7 as a pointy ear, which makes me think of elfin facies. And in what disease do you see elfin facies? Williams syndrome. And by the way, what's another autosomal recessive disease on chromosome 7? One is cystic fibrosis, caused by mutation in the CFTR gene. What diseases do we see in chromosome 15? Both of our imprinting diseases are here, which are Angelman and Prader-Willi. And how about for chromosome 17? Which disease is on that one? Think of a name that has 17 letters in it, which is neurofibromatosis type 1. Alright, last one. On which chromosome is the mutation that causes neurofibromatosis type 2? That's the 22nd chromosome.